I'm Dr. Philip Shallow. Now follow me here. We're going to talk about how to accomplish the adjustment. I have a lot of patients that ask me, if I can't feel the adjustment, what are you doing? How are you doing this? Let's start at the beginning. Here's the head. Here's the base of the skull, a model of the base of the skull. Here's the atlas that it sits upon. Now, the atlas is the only freely movable bone in the spine. When it gets pushed out of position, it's going to stay right where it's been put. Law of physics, a body at rest stays at rest until it's acted on by a net external force. Got it? Ha! There you go. And so now watch this. Watch this. Here's your atlas. You smack your head on the door. Bam! Atlas moves out of position. Can you see that? Now that little movement can be as small as ½ millimeter in linear distance, but we measure it in degrees because the bottom of the head is like a circle. And so the atlas is going to ride around that circle. And when we measure movement around a circle, we measure it in degrees. Got it? So the big job now is to get that to come back under the head very gently and very precisely. It's got to go exactly in the right position. And that's what we're all interested in. Now, let's talk about how we actually get the atlas to move. Within the NUCA procedure, the adjuster's body is the instrument that produces the force. So when I take the x-rays of the atlas, that gives me the math, the formula that tells me what angle to come in at to correct the atlas misalignment. Now that I know the angle, and let's say Mr. Bear here needs an adjustment, watch this. I've calculated his correcting vector to be a high 0. So here he is laying on his side. We have Mr. Bear laying on his right side because the atlas moved over to the left side. Got it? So I'm going to come in on the left. Now watch this. This is part of the complex lever. My leg going to the hip. The hip is the fulcrum, and my whole back up to the head. The force is going into the floor through my feet, the balls of my feet. The resistance is the extensor muscles of my back, and the fulcrum is here. That's the pelvic lever. Follow? Good. The shoulder lever consists of the arm, the fulcrum in the shoulder, and the back this way. So the force is going this way. The resistance is right here where my hands are locked. And as soon as I contract this muscle up here in the armpit, technically speaking, it's the long head of the triceps. There, I've just pulled off a nice pull. It created a nice force that went into that atlas and moved it sufficiently. And then we check all the indicators to tell me if it's corrected.